Moya-Moya.
Good morning, everyone. The topic that I choose to discuss is the Moya-Moya disease. To start off, Moya-Moya disease is a rare disorder of the blood vessels that supply the brain. The name Moya means puff of smoke. In Japanese, it is termed as tiny. Referring to the unique appearance of the abnormal blood vessels of a cerebral angiogram of the patient with this disease. The disease is characterized by the progressive thickening of the inner walls of the arteries of the base of the brain. As this thickening occurs, the blood supply is slowly cut off, eventually completely occluding or the blocking of the normal blood flow into the brain. As this progressive change occurs slowly over time, new blood vessels grow and enlarge to attempt to get more blood flow to the brain. This leads to small abnormal vessels which give up puff of smoke appearance on the angiogram. While it typically affects both sides of the brain in a small subset of patients, it may be one-sided. Why does Moya-Moya disease occur? The precise etiology of the disease is unknown, but there are several disease states that they are associated with the Moya-Moya disease, such as meningitis, Down syndrome, the childhood brain radiation, and the brain atherosclerosis. But in the study, inheritance is also play an important role in one person to have this disease. The Moya-Moya disease is an autosomal, so the person who would likely to have this disease is the female on the fourth generation.
Ganun pala yun.
Vasculitis, and the other condition that could be occur to the development of this disease is having the vasculitis or the inflammation of the blood vessel. Sign and symptoms. Number 1, TIA or the transient ischemic attack, seizures, visual changes, headaches, dizziness. For more severe neurologic deficit, the hemiparesis, ataxia, sensory impairment, aphasia, and developmental delay. Complication could be ischemic stroke, brain hemorrhage, seizure, or death causes brain hemorrhage. How it is investigated? Number 1, through CT scan and MRI scan. This shows stroke and hemorrhage. Number 2, CT angiogram and MRI angiogram show abnormal vessel blockage and microvessel proliferation. Number 3, cerebral angiography. It is the gold standard for evaluation. Special investigation, the CT perfusion and the PET scan or the positron tomography scanning characterize the amount of the brain ischemia or the circulation impairment. Is there any treatment? There are several types of revascularization surgery that can restore blood flow to the brain by opening narrow blood vessels or bypassing blocked arteries. It is called as STA-MCA or the superficial temporal artery-middle cerebral artery bypass. Children usually respond better to revascularization surgery than adults, but the majority of individuals have no further stroke or related problem after surgery. What is the prognosis? Without surgery, the majority of individuals with this disease will experience mental decline and multiple stroke because of the progressive narrowing of the arteries. Without treatment, this can be fatal as the result of the intracerebral hemorrhage. Nursing care. Number 1 is the obtaining detailed history. Of course, the safety of the patient. Always assess for the signs and symptoms such as sensory changes, difficulty of speaking, headache, seizure, and previous episode of decreased limb use. Family education for pre-op and post-op. Health teaching such as emphasizing to the family the importance of making sure that the medication such as aspirin and NSAID or the non-steroidal anti-inflammatory drugs such as ibuprofen can be stopped weeks before surgery so that intraoperative bleeding does not occur. Tapos, kinapos mo namin yun. That's all.
Yay!
Tiyan.